Casablanca is on?
Yes, he is. And just to go over everything with everyone, I've already asked him to unmute 42 times. So Dr. Casablanca, hopefully he unmutes himself. And there he is.
I am unmuted, Joe. I thought you were just playing games with me there. Or, it was one of those.
No, I was trying to be a little proactive. I'm like, you're on deck. I wanted to make sure that, it went smooth. But I just want everyone to know, and I know the board has a lot of questions, and I have had many conversations with Dr. Casablanca, and everything we've ever done in our reopening plan it's all about the safety and health of our staff and our students and the community. And whatever we're going to do or wherever we're going to move forward to and how we progress is going to be based on, the recommendations from our medical advisor, Quinebaug Valley Health. But we have Dr. Casablanca on the line, and this is the time and opportunity as we are seeing our numbers go up. We are well within that red, which they said, 25 per 100,000. We're right now 27.1. And where do we go from here? I have buildings that are out already, but I want to know what Dr. Casablanca is seeing actually in the medical field, what he's seeing at the hospitals, and I want my board to really get the clear picture of what is happening out there and the recommendations that he has moving forward. So, with that said, Dr. Casablanca, you have the floor.
I guess I'm on the spot, huh, Joe?
Yeah, really are.
Hello, everyone. Thanks for having me to the meeting tonight. As Joe mentioned, Ansonia right now, according to the town data, is at 27.1 cases per 100,000 population, which puts us into the red zone with a high transmission risk. I think the thing that's bothered me more just in general is just how much more activity we're seeing in the community. Just to bring you up to date on the COVID-19 tracker for Connecticut, the daily report, this was updated. Actually, I'm clicking onto it now. Today or last night at 8:30 p.m., we had a 4.76% daily test positivity yesterday. The day before, we were at 6.7%, and this compares to just a couple of months ago when the state was under 1%. But just in the last 24 hours, 36 new patients admitted to hospitals across the state for a total of 584 people hospitalized, and another 9 people died yesterday. So up to 4,716 deaths in state. At Middlesex, we've not been hit quite as hard as Yale or Hartford have been hit in terms of number of admissions. Just to compare, right now there's in New Haven County 221 people hospitalized, including 24 new people overnight. Hartford County has 149 people hospitalized with 6 new admissions, and 156 people hospitalized in Fairfield County. I could tell you those numbers about a month ago were all either zeros or single digits. And there was about 150 new patients admitted in the Yale system overnight. I do not know where Griffin is in terms of their numbers. I would suspect they're a little bit less than where we are in Middlesex, even though we're in Middlesex County. But I could tell you that we have right now 29 people in our hospital who are at least under surveillance for COVID. About half of those have tested positive and half are still waiting results. So they're not all going to be positive. The good news in some of this is that it really, Joe, correct me if I'm wrong, I think we've only had with the kids 4 or 5 cases since we opened. Is that correct?
With students, yes.
And that most of our problem is coming in the fact that we have teachers and other staff who live outside of Ansonia who, because of activity in their home districts, are going to have trouble making it into work. And so it's really setting up a problem with personnel. The kids throughout the state, especially from people I've spoken to, have really not been as big of an issue as the adults bringing stuff in from the outside. So I don't know what the teachers on this call are seeing on the ground. I'm not personally in the schools right now, so I can't comment on that. But I think the fear is that if we stay in the red, we're going to be opening up opportunities for kids to get sick. The state is going to come out with their new numbers tomorrow. Those get posted on Thursdays in terms of the rate per 100,000 in schools. in the community. If Ansonia stays in the red, the guidelines from DPH on school reopening is that we should go to 100% remote. So I know Shelton, as of yesterday, which is my other district, went 100% remote on Tuesday. And I know other districts have moved in that direction. I don't necessarily want to go there, but I think we kind of have to go there if the other districts are closing. We're going to put too many people at risk, and we're also going to have to worry about staffing the schools. So even though the kids have done a great job, the community numbers would suggest that we probably need to think about going remote for the rest of this semester, and then be open to what decision we're going to need to make in January. So Joe, that's about where we are, I think. Do you want to add anything to that?
I do. I want to chime in. I want to let the community and people here know between the students wearing masks, which I never thought they would, they're doing a great job. Our staff has been unbelievable. My teachers have been, I know there's a lot of anxiety, but they made it work. My administrators are really stepping up. And as these numbers start creeping up, it's getting of greater and greater concern for us and what we're going to have to do. So, I mean, we will be, I know after this call, I'll be talking to you, Dr. Casablanca, further to really see what the direction and where we're going to go. I mean, I know 4:00 tomorrow is when they release numbers, and that's how they reset where we are. But Jessica Stelmazik at the Naugatuck Valley Health District gives us updates every day based on our numbers, and our Ansonia is an overachiever when it comes to the numbers that we're having, and that's something we don't want to be an overachiever at. I mean, if you look at the Valley, the numbers that of positive cases, it's not something that it bodes well for us. So it's difficult decisions are going to be made, and they're probably going to be made relatively soon. And it's going to be under the advisement of Dr. Casablanca. But I understand. I hear what you're saying, Dr. Casablanca, and we've known it. And as far as my families, my students, and my staff has done everything they could to open up safely and keep as much normalcy as we could. And so I applaud them, because in some districts, and Dr. Casablanca, you could tell me if I'm wrong on this, you're seeing a cascading effect of the virus spreading within buildings, or anywhere you go. And one thing that people have been able to do is a very strong job of mitigating that, moving forward. But it's something that we all need to really look at. The fact that in other places it was much different. And you muted yourself, and I am going to unmute you, Dr. Casablanca. Okay,
I should be back, right? A couple things to add too, and this is, I think, where really a lot of nervousness comes in. College kids are going to be coming home for Thanksgiving. Families are going to be gathering, and the rules right now in phase 2.1 is we're not supposed to have more than 10 people at an indoor gathering. I suspect that's not going to be universally followed, human nature being what it is, even though it should be. And I think those kids staying home through January is going to be an issue, and those kids are going to have to be negative when they go back. So the college kids are going to have to be re-COVID tested before they go. And I think we're going to be in a time frame between now and January where there's going to be more potential for disease to spread. Plus, we're indoor, which is an issue. Flu season's coming up. My own personal thought is I think we're going to see less flu because the masks are going to prevent that. And that's similar to what we saw in South America in their winter, which was our spring. That the spread of influenza was not what they expected it to be. But either way, dealing with the usual flu and winter illnesses and colds on top of this threat is really going to, I think, be a difficult thing for us. So I agree with Joe. I'm really proud of the job that the kids have done, and all of the teachers and staff trying to stay safe. But I think if the trend is that other systems are going to close, it's going to put us in a pickle that I think we're not going to be able to avoid. just as an additional thing here, I want to pull this up that was sent to me. In terms of our average daily cases, we mentioned Ansonia is at 27 per 1 per 100,000. Just to give you an idea what's going on near us, Seymour is at 17.7, so we're higher than them. Derby's at 17.1. Shelton's at 15.5. Monroe's at 18. Those are all the towns in the red. Orange is in the orange, but they're close. They're at 12.8, and Oxford's at 10.3. Beacon Falls is down at 8.1, and Bethany at 9.1. But these are population trends, not school trends, if you will. So I think our schools are performing better than our town, but certainly at 27.1 cases per 100,000, we have the highest community rate of the Valley towns right now. So I think we got to be careful. We got to keep paying attention to that. So we'll see what the numbers show tomorrow, and we'll go from there. But I think we're probably going to have to go remote.